Good morning, everyone. My name is Kirsten Bayer with the Illinois Center for Specialized Professional Support at Illinois State University. I will be on for moderation and technical support today. Thank you for joining us. Today, we are excited to welcome back Sarah Glazer from the Clear Language Lab at Literacy Works. And she is doing part two of creating welcoming and effective written communication. So if you have not seen part one yet, definitely make sure you check that out after today's webinar. She provides some great resources for us. So we're excited to welcome her back. A couple of housekeeping things before we get started. We are on Zoom meeting, meaning that you have the capability to turn on your camera or your microphone, and Sarah does encourage you to do so and fully participate. And I will ensure that Sarah's face is the only one that's on the recording, but you can definitely turn your video on if you would like to converse with her or ask any questions. You can also type any questions or comments in the chat, and I'm happy to help facilitate those to her. Also, you will receive a follow-up email tomorrow that will have a follow-up survey in it. We just ask that you take that. It's 5 questions. The WIO Professional Development Committee is who created it, and it helps us determine if we're meeting the state where you all need professional development, as well as providing new, fresh topics that you want to see in this Workforce Wednesday webinar series. And then today's webinar is being recorded, and you will receive the recording in your follow-up email as well as the slides and resources from Sarah today. With all that being said, I'm going to start us off with our beginning polls that we do every Workforce Wednesday webinar, and then we'll hand it off to Sarah. The first one is, which location are you joining us from today? So where's your local area? So we just want to make sure that we're hitting across the state. So if you could take a couple seconds to answer that for us, we'd greatly appreciate it. Okay. I'm going to end the poll, share the results. Looks like we're meeting a good span across the state. Quite a few people from Chicago and Northern Illinois. And then honestly, we're evenly spread out all across the state. That's awesome. I always like to see that because it feels like we have good representation from everyone. The next one is, which partner do you best represent? So let me stop sharing this one. And then if you could go ahead and answer that, if you best represent Title 1, 2, 3, or 4, or an other WIO partner and stakeholder or state or local workforce innovation board. We'll give everyone a couple more seconds. All right, I'll go ahead and end that. Looks like we have good representation across the titles, but primarily from Title 1 and 3. So I'm excited to see that. Thank you for joining us and spending your morning with us. We really appreciate it. And I'm going to hand it off to Sarah to get her presentation started.
Hello, everyone. Good morning. Like Kirsten said, I'm Sarah, and today we're going to be talking about creating welcoming and effective written communication, part two, communicating with a trauma-informed lens. Before we get into introductions and stuff, my screen will stop doing that shortly. We'll fix it in a second. Welcome some business before we jump into our content. Please participate however you feel most comfortable. That could be the chat, that could be unmuting yourself. Feel free to use like the emojis, the reactions. Keeping an eye on everything. Please ask questions as they come up. There's no need to wait till the end to ask your questions. We don't have a break, so do what you need to do to take care of yourself. If you need to step away, no worries. And then all of the slides and resources are available in the training resources Google Doc. I will share that link in the chat real quick. It is a case sensitive, sorry, I can't type. and talk. It is case sensitive if you're putting it in, just to know that. Let me just share that. Okay, so you can open that up, and I'm just gonna show real quickly. When you come to it, if you don't see this little menu on the side, on the top left of your screen, you'll see a like this little icon. It has the number 6 and some lines. And if you click on that, it opens up a menu where you can get the notes and resources from last week, and then all the notes and resources for today. So that's something to worth checking out when you have time. Bookmark it, save it, add a shortcut to your drive. And then when we get to later looking at examples, there are all of the text examples we're going to be looking at. There's a plain text version in this doc because I know the slides can be difficult. Not everyone can easily read when there's a lot of text on the slide. So you can look at the plain text versions if that is easier for you. Um, yeah, we'll continue on. Like I said, if you have questions, go ahead and throw them in the chat. And I'm going to close this so my screen doesn't keep bouncing back and forth like it weirdly was doing last week. Okay. Now I lost my other slide. That's weird. Okay. Don't do that. Sorry, y'all. This is like only happening very recently. I have to figure out how to make it stop. All right, so who am I? Like I said, my name is Sarah. My pronouns are she, her. I'm the senior program manager for the Clear Language Lab at Literacy Works. And so my job is to help folks from a wide range of sectors create clear and usable communication through training and materials review. Previous to this, I was a language arts teacher, and then I taught adult ESL. That was most of my time teaching, was working with adult English language learners. So a lot of the same folks that you all work with. Um, and I learned a lot about communication in that role and often saw that the barriers my students experienced or expressed were often less about their English language skills and had more to do with the content that was being shared with them just wasn't clear, wasn't uh, understandable or usable to them. And we'll do a little introductions in a second, but something bringing me joy today is my sister-in-law is visiting today. She actually just landed at O'Hare a few minutes ago, so we're very excited. She hasn't visited since before the pandemic, so we're excited to have a fun time in Chicago. If you would like to introduce yourself in the chat, it's always nice to see who we got here. You can share your name and pronouns, your role, whatever you want to share about that, and then something bringing you joy today. And I'll leave that up for a second if folks want to share something, but no pressure. And I know we have some folks who were here last week. So I'll quickly go through like some recaps and introductions again. For folks who are not familiar with Literacy Works, we are a Chicago-based nonprofit, but we work with folks across the United States. Um, and we believe access to information is critical for a fair and equitable society. So we do that two ways. We have our community literacy program that does capacity support for adult education programs. So things like training tutors and teachers, mentorship for adult educators, and working with program staff. Um, and then in the Clear Language Lab, we work, like I said, across sectors to help create communication and systems that are more useful, understandable, and equitable. And we do that through trainings and also helping people create content or do materials review. I see a lot of introductions in the chat. Nice. We got a lot of IDES folks today. Oh, nice. Oh, grandbaby due any day now. I hope it all goes smoothly. Very excited for you. Awesome. Oh, spending time with your cats after your vacation. Yeah. I the cuddles after being out of town are always so special. Um So in the Clear Language Lab, we are thinking about how to make plain language and really clear communication the norm, not something that we do special or extra, but just really the standard of how we communicate. We try to think about how to center folks who have been traditionally harmed by systems, and I think thinking about trauma-informed communication is a big piece of that. We try to co-design with our audience as much as possible. Um, we think really broadly about accessibility, so not just what's required by the ADA, but really thinking about how do we make information and content as accessible and usable to as many people as possible. We believe communication is really about building connections, and at the end of the day, we want people to just be able to participate in their lives, whatever that looks like for them, whatever feels meaningful. Ooh, I see in the chat someone's going camping and floating this weekend. That sounds awesome. I hope you have great weather. So today we're going to be talking about what it means to have a trauma-informed approach to communication, why this is a lens we want to consider in workforce communication. Uh, we'll examine what the trauma-informed principles look like in practice and look at some opportunities to incorporate reflection and the trauma-informed principles in your work. And just a reminder, I'm not here to help you, to tell you how to do your jobs. I don't do what you do. I've never worked in workforce, so obviously there's things you know that I don't know. And I'm hoping though to help you see maybe a different perspective and give you some strategies that you can take and use and apply to your work in whatever way makes sense. And just a reminder, in case we had any latecomers, I'm going to share the link in the chat that you can open up our training resources doc, and all of the examples of all the text examples we're going to look at are available in there if it's hard for you to read them on the slides. So we're going to start off, since this is part two, we're going to do a little review, a little recap of what we talked about last week. So this is your chance to show off what you learned, what you remember, or if you weren't here last week, because we'll have some time to catch you up, because a lot of the plain language principles that we talked about last week overlap a lot with the strategies that we want to use in trauma-informed communication. So feel free to unmute or share in the chat. What do you remember about plain language? What stuck with you? Or if you weren't here last week, what comes to mind when you think about plain language? See. Yeah, I see in the chat. I think it's mainly about ability to communicate in a simple, straightforward way, easy to understand, straight to the point. Let's see if I need give another few seconds. Using simple words, avoiding jargon, using clear, concise language. Yeah, awesome. I'm sure we'll get a few more coming in, but we'll keep chugging along. So our reminder, the kind of standard or common definition of plain language is communicating so your audience can easily find the information they need, understand what they find, and use that information to do what they need to do. So all the things that folks are sharing in the chat are tools that we use to do this with our audience, right? We use simple, concise, clear language. We avoid jargon, use simple vocabulary so that our audience can find and understand what they need. Yeah, I see in the chat the way information is presented is important. It shouldn't be cluttered. We want to think about how we're organizing or designing content. It should be easy to read, easy to digest as much as we can. Awesome. So we're going to look at an example and just kind of thinking about some of the strategies that we talked about last week. Again, recapping a little bit. Here's an example. Take a second to read it. This is in that plain text Google Doc. So if that's easier for you to read, you can open that up. But go ahead, read this, think about it, and then you can unmute or share in the chat. What could be challenging about this job description, right? When we're thinking about that find, understand, and use definition. What could be challenging about this job description, and how could we make it easier to understand and use? And I'll give folks a second to read that. When you're ready, you can just start dropping your answers in the chat.
For me, I think it would be nice for it to have bullet points, where it has a list of things that would read a little better.
Yeah, it's a lot of information. Some bullet points might help break it up visually and maybe separate the ideas. I see it's too complicated, it's not clear. There's a lot of special terms, right? It's using some jargon like non-residential care facilities and convalescence, technical terms that might not be meaningful to the to someone who's new to this work. I see why use assist when help does the job. Yeah, a great example of where we can swap out a simpler word that gets the exact same idea across. So how does this version feel clearer? What's changed to make this version clearer?
Just how you're breaking up the information in sections
Hmm.
and the use of the bullet points.
Yeah, so there's clear sections with headings and bullet points.
And just basic language, like an older adult instead of elderly,
Hmm.
person with a serious illness, who had a recent surgery. I'm
Yeah.
or, instead of using convalescent. So
Yeah, exactly. So when we think about, and that covers a lot of it, right? So it uses everyday language. It's talking directly to the audience. So a lot of times, we can connect a little bit more meaningfully with our audience when we speak directly to them. So using that you pronoun to say, hey, this is what you need to do, or this is what you will do if you do this job, things like that. There's headings that break up the text into clear sections, right? So these are the questions that someone would probably have about this role. And then, like we talked about, we removed some of the unnecessarily complex language and jargon. So convalescence was replaced with a person with a serious illness. Um, the incumbent, I think was right, like the person who you would care for. Um, and then in regards to is it was taken out. And then another example, the idea of using older adults connecting to what we're talking about with trauma-informed communication. A big part is kind of being speaking respectfully about our audience and to our audience. And a lot of older folks don't like the term elderly, right? That is not a phrase, that is not a label that they identify with. Um, and so instead we could use something like older adults that more people feel like is a label that that is meaningful to them, that feels respectful to them, right? So that's another piece of kind of thinking about how we're talking to and about our audience is the labels that we're using and do they resonate with whoever our audience is. And so to recap these key ideas of plain language, word choice is absolutely an important part of it, but as we've talked about, we want to think about what matters to our readers, kind of centering their preferences, their experiences, having that clear information design, organizing information in a logical, easy to digest way, and having that clear purpose. And so we talked last week in part one about plain language strategies and the idea of the curse of knowledge. And so today we're going to dive into this to having a trauma-informed approach. So what is it? What are we talking about? So we have another example on the screen. I'll read it out loud as someone kind of sharing their experience and thinking about what is this connection between kind of having a trauma-informed approach or trauma and communication? What stands out to you? So she says, I haven't been sleeping well since I was laid off. I need to find work, but it's hard to focus long enough to make sense of long, complicated job descriptions or to write a cover letter. When I do submit an application, I never know if I'll hear back or when, which can make it feel like it's not even worth trying. So what stands out to you about how this might connect the idea of trauma and communication? Yeah, our ability to comprehend text can be impacted by our mental health 100%. Right? So she's saying like I can't even focus long enough to get this to get started, really, right? That's hard.
I think it helps. I don't know if this is the route you were going, but I do think it helps with our perspective working with or providing services for individuals who become unemployed. Some individuals may have never experienced that, excuse me, but for anyone, that could be a stressful situation. So, with us keeping that in mind when we're communicating with them, we're making sure that we're thinking about these things, like making sure whatever we're describing is not complicated and giving them a clear idea of when they will receive information or whatever the case.
Yeah, absolutely. And that, right, that's the really the heart of this idea, right? This example, starting off here, that when we're experiencing trauma or when we have experienced trauma or when we're experiencing the situations of high stress, um, right, feeling tired or fatigued can make it really hard to process information. And oftentimes, stress and trauma is really draining. It takes a lot of energy out of our brains and our bodies. It can also make it hard to process or focus and process information. And then this last piece about, right, like, I don't know if I'm ever going to hear back. So what is the point? I think, right, these unclear processes can create a lot of anxiety for people, and can make it feel really like it's not worth their time or that it's too much effort to try, right? Because it's what you don't know if there's going to be any payoff to it. And that's a lot of anxiety that it can create for people. So if you're new to the idea of trauma, if this is something that you haven't, you know, haven't heard of or thought about before, this is a very, very simplified explanation. I'm sure there's mental health professionals who have could explain a lot more nuance to this, but essentially, trauma is when people experience something that's a distressing event or events, and it has a lasting impact on us. So we don't just experience that distress in that moment. It's something we carry with us for a long time, past that initial event or events, whatever that may be. And it's not something we can define for other people. So we don't get to say, what you experienced is not traumatic. That's really between someone and their therapist, right? Like that is not our job to define for someone else. But we know that it's extremely common. A lot of people have experienced some kind of trauma or experience stress or the impacts of trauma in some way. And it can look really different. It shows up in a lot of different ways. And so, because it is common, we can think about having a universal precautions approach, right? Thinking about if we do this for everybody, we know that we're gonna make systems and content easier for the people who really, really need it, and it's gonna help the people who maybe don't require it, but it's still gonna be good for them. And stress and trauma, like we've already kind of touched on, the reason we talk about this with communication is it really impacts how we process information, how both like what we remember and just our ability to navigate really complex things. It also affects our physical well-being. Do we feel tired? Do we feel drained? Do we feel physically sick or ill? And those things impact our time and our ability to navigate information and systems. Um, and also it impacts our emotional responses. So we may not, on our best day, we may not get upset about something, but if we're experiencing something if we're going through a time in our life that is really high stress or experiencing the impacts of trauma, we may respond, right? We're kind of at our worst day. We may respond negatively to something. And so we want to be thinking about, keeping that in mind when we're um, thinking about how we communicate people and also how we interpret people's maybe emotional responses to things. So this is the technical definition from SAMHSA. SAMHSA is a national mental health and substance abuse organization. And so they have this definition of what trauma-informed programs, organizations, and systems do or look like. And I have the last two highlighted because that's really what we're thinking about. We're not in most of us, I think here are not in the role to be thinking about paths to recovery or identifying signs and symptoms and doing treatment. That's not our role. But where this conversation fits into our work is thinking about how can we integrate knowledge about trauma into our policies, procedures, and practices? So how do we be aware of this and thoughtfully incorporate it into how we do our work? And then actively seek to resist re-traumatization. So really thinking about how are we making sure that we're not making things harder or making things worse for people. And at the end of the day, it's really about creating welcoming environments and processes, right? We want people to feel safe and we want them to feel welcome when they come into our spaces or when they read our communication. So we want to go from this, right? Someone who is experiencing a lot of stress, having a hard time, to something like this, where she says, my local job center helped me enroll in a training to boost my skills and worked with me to improve my resume. They also connected me to a clinic for my sleeping issues and anxiety. I'm still nervous about the application process, but I don't feel like I'm going through it alone. And so we can keep this example in mind as we talk about the different aspects of trauma-informed communication. Um, but we're seeing that they're, right, creating, she feels safe, she feels like she's supported. Right, there's this collaboration. I'm not going through this alone. I have people who are supporting me. And also we're treating her as a whole, complete human, not just addressing one aspect of her life, but thinking about how can we, within our capacity, help support other needs that people might have that are connected to or related to um, their their employment goals or things like that. So, we're going to take a minute to do a little reflection. If you'd like to share in the chat, think about a time you had a good experience in a new place. It could be a virtual experience or in person. And think about what did they do that made it feel positive, comfortable, helpful? What were some of the things you noticed in that experience? I'll give folks a few minutes to think about that.
Well, I can give an example.
Yeah, go ahead.
Uh, so so sometimes I would do volunteering for like different runs, different events, and going into the environment of an environment that I've never been in before. And what made it more comfortable was them having someone there to provide direction and knowing exactly where I need to go and what I need to do. That made
Yeah.
the situation much better and more comfortable.
Yeah, so I hear you saying, right, the idea that there was a person, a clear person who could kind of answer my questions or tell me what I needed to do, and that there were clear instructions. I wasn't just kind of dropped into a situation, but it was there was someone there whose job it was to connect me with the next steps or what I needed to do. So so it helped you feel like you were supported, like you weren't adrift. You knew what you were to do, knew what to do, knew what was expected of you.
Exactly.
Yeah. And I think about things like as simple as when I go somewhere and someone greets me and smiles and says, "Hi, how are you?" Right?
Mhm.
Kind of meeting me at a human level. I think about things like, yeah, seeing or hearing a welcoming voice. Um, so I think it's important, right? How do we greet people and make them feel welcome? I was just in a bookstore recently that was a queer bookstore. So they focused on stories about the LGBTQ plus community. And the I heard one of the cashiers having a conversation with someone and just started off asking what their pronouns were, right? Because being really just right from the bat, helping me people feel, what's your name? What are your pronouns? Welcoming someone and kind of being open to um, helping people feel safe in that space where there's definitely going to be a lot of different gender expression there, and it can be in a standard practice so no one feels like called out. Um, Helping people feel seen in that way, I think can make people feel welcome. Yeah, any other examples that folks are noticing? So keep this in mind as we go through, see what maybe jumps out at you. And we're going to start off with just kind of getting into the principles of trauma-informed communication. So these are um, the principles of trauma-informed care. These come from SAMHSA and the CDC, so the Center for Disease Control, kind of are and kind of have a publication about breaking down these ideas, and they're used in a lot of different spaces where people are thinking about how to be trauma-informed or trauma-informed practices. So you may have seen these in other places. And we're going to break down examples of what they can look like in communication and processes, specifically related to some of the work that y'all do. Um, but the 6 principles are safety, trust and transparency, peer support, collaboration, empowerment, voice and choice, and humility and responsiveness. And these are some of them are shortened a little bit to fit on our slides, but the idea is there. And these are not, it's not a checklist. They're not like in any specific order. They're just things we want to be thinking about when we're creating communication. So we're going to talk about what these look like in communication environments and processes. And I'm just going to say, I'm going to share a lot of examples. And I recognize right now, especially in 2025, there may be things, some examples here that are not a good fit for your organization based on factors outside of your control. So use what you can and leave what you can't, but be thoughtful about how you're incorporating the principles in your work and what those can look like in practice. So when we're thinking about safety in communication and processes, we're really thinking about our tone, right? Are we smiling, both literally or in like the tone of our content? Does it feel friendly and welcoming? And that's related to word choice, which we'll look at a kind of some research behind that. Um, it's also thinking about our spaces. Do they feel welcoming? Do they feel warm? Do they feel safe, or do they feel cold? Right? Are they decorated? Do they feel like human beings exist there, or does it feel like a concrete box? And then a big piece of emotional safety is how do we remove uncertainty for people? And so this is things like making sure that people know what to expect before, during, and after an appointment, right? So being really clear, saying, you're coming on this day. This appointment will take 2 hours. You need to bring X, Y, and Z. We're going to talk about A, B, and C, right? So being really clear about what people can expect from an experience. And then we also want to think about how are we making spaces feel visibly safe, right? So having things, this is where like having pride flags can make a difference in signaling that we're at least we want this to feel like a safe space, and we'll talk about how to follow through on that with our actions, right? But we want to make sure that our spaces that we're using imagery, symbols, things like that. And then also in the language that we're using. Are we using, like with that example, are we using elderly people, or are we talking about older adults, right? And that idea of what feels more respectful and inclusive to the audience that we're talking about. And one reason why we kind of think about word choice as part of the idea of safety is there's a study that was done where these were people who were like involved in legal proceedings, non-criminal legal proceedings. And they kind of asked them to read it was like their own court documents or the legal documents that they had to interact with as people who were involved in this process. and kind of react to, share their reactions. And people said things like, I think this quote's really powerful, but this was not the only one. It really captures an idea that the original text, it was all in the English language, yet I could not understand the mumbo jumbo. This for me feels condescending and corrupt. And so that doesn't feel safe. That doesn't feel good, right? To be like, oh, they're talking down to me. This doesn't feel respectful. I can't trust them, right? To say it feels corrupt says like I feel like I can't trust this person based on how they're communicating with me. So it's really important we're thinking about using language that connects with and resonates with our audience. The next value or principle we're going to talk about is trust and transparency. So this is thinking about, are we explaining why we do things the way that we do? If we have like really specific eligibility requirements for our program, do we tell people why we have those eligibility requirements? It's often tied to funding, and we can say, because of the funding we get, we can only serve these folks. And that can go a long way into helping people understand why things are the way they are and also help make it not feel like they're being personally targeted, right? Because they understand that these rules exist for a specific reason. Um, we also want to be honest about our limitations, right? Not over-promising, but being clear about what we can and can't do. And using plain language in legal documents and forms. So one aspect of this is thinking about if we have people signing consent forms, do they actually understand what they're signing off on, or do we need to revise it to be in clearer, more plain language? So this is things like, do our forms only ask for required personal information and explain why we're asking for it, how this information will be used, what happens if they leave it blank, right? So a great example of this is if your forms ask for social security numbers. Um, Folks may be reluctant to share that information for a variety of reasons. Folks may not have a social security number. And so being really clear about what's going to happen to that data, if it gets shared with someone else, how you're using it can go a long way in being transparent and helping people feel like they can trust you. And another example of thinking about trust and transparency is making sure that our content that we share is up to date. So one area we experience a lot when we talk to our community group about their experiences with communication in the world is them saying things like, I went to this website, someone told me I could access that I could use this program. And so I went to the website and it had information about how to register. And I tried to register, but it didn't work. It wasn't accurate anymore. And so now I'm never gonna work with them again. That was an unpleasant experience. So of course we want people to, have grace. We all make mistakes. We all forget things, miss things. But really being thoughtful and thinking about how is our information organized to be accurate and easy to understand and navigate. And so another aspect is peer support. So this is thinking about how do we connect folks with people who have had similar experiences or are going through similar experiences or someone who's been through the process that I'm about to go through. And this is both for, the clients we may work with and also for staff. How are staff supported in their roles? A lot of the work that y'all are doing can be challenging, can be emotionally draining to be supporting people going through some challenging times in their lives or helping them navigate complex systems. So, are there pathways for staff to learn from each other, to share what they're learning, to share their experiences, um, and also to like commiserate, right? Sometimes things are hard and we just need someone to be like, yeah, it is hard. Right? So, are we creating those spaces for those meaningful relationships? And then again, thinking about, do we have peer mentoring opportunities? Maybe if you're referring someone to a job training program, do you have alumni from that program who they can ask questions, who they can ask their questions to, or who can help them with the registration process? Thinking about things like that. So collaboration is thinking about how do we make people feel included? How do we use inclusive language rather than feeling like authoritative or exclusive, but really we want to be inviting to folks. And then thinking about how we're collecting and using feedback. So this in practice could be thinking about, do we have processes for participants to help us choose topics, right? Maybe we have a group of an advisory board, or maybe we just have a fish bowl in the lobby where people can suggest topics that are interesting to them, or we have a bulletin board and people can make a mark to vote on the topics that are most interesting to them, right? Thinking about ways to collect feedback from folks who are um, affected by the programming and the policies that we have. I really recommend if you have a handbook or like specific program requirements that you make time to have to get feedback on those requirements from people who are actually in the programs, right? Saying, if you have an attendance policy, right? Asking folks, hey, does this attendance policy, like, is it feasible? Was this something, does it make sense to you? Do you understand why it's there? Is there something that would be better? Is there a different way we can explain it or support you, right? Getting some insight from the folks who are on the receiving end of that information can be really helpful in making it clearer and more effective. And then we're also thinking about with collaboration, how we're partnering with our community partners, right? I know a lot of you all do a lot of like referrals are a big part of your work, right? Helping people get connected with other resources or employers. And so thinking about how do we have strong relationships with those partners so that we're not just sending someone off into the abyss, but we can do something called warm referrals. Like really think about how we are um, thoughtfully connecting people with other organizations or partners. Uh, Empowerment, voice, and choice is really thinking about how are we incorporating people's preferences. So are we offering meaningful choices? It's thinking about how we document, so keep track of the challenges that come up so that we can address them in a strategic way. And it's again asking for that consent in plain language. Are we right? If we're asking people to make a choice, do they actually understand the choices that we're offering to them? Is that being communicated clearly? So I was just thinking about some examples of choice could be which services do they engage in, right? Um, do they get to choose how they engage with your organization, or do you have a rigid kind of plan that people follow? How they access services. So thinking about can we offer in-person and virtual ways for people to engage in content? Or maybe we offer both phone calls and video calls because some people find it right. People have different preferences for various reasons for either one. So thinking about things like that. And then really carving out time for that space to ask questions, like the example that someone shared at the beginning of there being a kind of person to direct volunteers. That's also a person that if you're not sure what to do, if you have a question, you know who to ask. And that goes a long way in helping people feel like they they know what's expected of them and can engage with things in a safe and welcoming way. And the last one is the idea of humility and responsiveness. So we're thinking about this is like thinking about cultural humility, how are different cultural practices reflected in our work, making sure that we're choosing both images and content that reflect the communities that we serve. But it's also about exploring and challenging our own biases, right? So I think, especially when we think about what's considered appropriate for the workplace. There's a lot of cultural values that are behind that may not actually that are not universal. So understanding that, right, what's people from different places or different cultural backgrounds may have different expectations of what's considered um, like normal coworker interaction or what's considered appropriate dress for the workplace, right? So making sure that we don't take for granted that people have the same understanding as us, and also that we're being thoughtful about like how um the norms that we do enforce, and that we're doing so in a way that is it, acknowledges and respects those differences, and that and how we think about that. And so the part of this is standing by those diversity, equity, inclusion, and accessibility initiatives and codifying practices that lead to concrete outcomes in these areas. So really thinking about not just having those pride flags, that's great. That signals we want to be a welcoming space, but that doesn't actually that's like the first step, right? We also have to follow through with our actions. So things that we can do to kind of codify um, or make it a standard practice is things like having know your rights resources for folks, um, using gender inclusive or gender affirming language. So that depends on gender inclusive is that idea of being either gender neutral or using language that is, things like on forms, not limiting it to male and female, but having using gender, distinguishing gender and sex correctly, and using things like if we're asking for gender, giving people a range of options or leaving it open for people to write in what their identity is. Um, and gender affirming language is responding to kind of how, when we know how people identify, being respectful and using language that reflects the identity that they've shared. And then thinking about how we're providing translation and interpretation in a systematic and inclusive way, making sure we're doing what we can to make that easily available to the folks who need it. And then it's thinking about this idea of reflecting on our work because we're never we're there's always going to be things that we can improve on. There's always going to be new challenges that come up. So nothing we do is like, okay, it's done, and then we never have to think about it again. There's always opportunities to learn and improve on the work that we're doing. And we'll talk about that at the very end a little bit more. So we just went, is kind of jumped into a lot of these ideas. Just a lot of examples. And I'm curious if you have examples either of how you're already doing these things in your work, so you can unmute or share in the chat, or if there's ideas that are coming up for you. And we'll look at some more concrete examples in a second, but I want to hear just from kind of going over these principles, what's jumping out at you from your work, either that you're already doing or an opportunity that you're noticing.
I think all of these are important, especially in the workplace. Collaboration for sure. There's a lot of problems and issues that are maybe shared across units or departments, and being able to collaborate on those things, getting different perspectives, peer support for sure, empowerment, just building that trust. I think all of it is pretty much important, and humility as well. Being able to know that we still have a lot to learn and learn from others, and being able to humble ourselves to that point, to have that perspective.
Yeah, thank you for sharing that. And I think something I think that you shared that I would love to reiterate too is the idea that like people are often experiencing in different, maybe different departments, different roles, or just different individuals experiencing similar challenges to us. And finding those opportunities to collaborate and to have peer support is a helpful, not just like emotionally helpful to be like, oh, you're going through the same thing as me. We can like be on the same page, but also just in terms of like efficiency, right? It goes rather than having six different people trying to solve the same problem individually, if we can collaborate and work together on a solution, then it's going to be a better experience for most of us. So I think I heard that coming out of your comment, and I think that that's important to think about. Any other examples that are coming up for folks? So if you think of something, feel free to drop it in the chat. but we're gonna look at some more concrete examples of how these principles show up in communication. So here we have an example. This is in that training resources, the plain text examples. I'll share that link one more time in case there's anyone who doesn't have it anymore. But we have two, the same question reframed. How is the tone different? What do you notice about the tone or how this feels when you read it between version 1 on the left and version 2 on the right?
I mean, I think the one on the right is definitely um, better language, I guess, universally, like for anyone who's reading this is very
Respectful. You're
specific.
looking for work respectful.
Right. Like instead of saying limited transportation, who uses that term really? So getting better transportation is better, a better way to say it.
Yeah, so it's using some more kind of clear everyday language, right? It's reflecting how people actually talk when they're communicating in the real world, not kind of our business language. I see number 2 is more positive. I heard the words respectful. Yeah, so when we're thinking about kind of tone and how this relates to being trauma informed, so we actually, this was from a project we worked on, and we shared this with our community group, which is folks across kind of the, oh, I see a comment in the chat that it focuses on solutions instead of problems. Yeah. Um, we have a group of community members who we bring our projects to, and they live, a lot of them in the Chicagoland area, but also Northwest Indiana and Wisconsin, and other parts of Illinois as well. And when we brought this project to them, they said things like, it feels like it's blaming me for things. Like it feels like it's saying that needing childcare is my fault somehow. When it's right, it's just we live in a culture where sometimes it's really hard to find affordable childcare. Or that like not needing wanting right that my education is the problem. Not that I need to build skills or that I want to build skills, but that my education is the problem. Um, People also were confused why they were asking for this information. They were like, can you help me with these things? Or are you just collecting data, right? So that transparency piece, people were like, why are you asking for this? That felt weird to them. And then there was some language questions, right? So like the limited transportation, justice involvement, a visible or invisible disability was language that was unfamiliar to a lot of folks. Um, so one way we can be more trauma informed is just thinking about how we talk about challenges and barriers and reframing it as opportunities. And we're not doing this to try and pretend like we're not trying to say that these aren't challenges. We're not trying to like put on rose-colored glasses and pretend that these aren't real issues that people might be struggling with, but rather it's about framing it in a way that feels like, A, we're not judging or blaming people for being in these situations because oftentimes these things are out of their control. And it's about like if hopefully we're asking for this information because we want to help in some way, right? Or we want to identify ways where we could maybe improve our services. And so framing it as an opportunity helps people understand that intention. So what makes this version feel a little bit better, right? We think about safety. It's shifting from that blaming language to opportunities. It's using that everyday language that's a little bit easier for folks to understand. Um, and then it's using something called the parallel structure. You'll notice that each line starts with that ing verb. So when we make lists, we want each item on our list to be grammatically consistent, to feel grammatically similar. And in grammar terms, that's called a parallel structure, and it helps people more easily process the information in our list. And then the ideas are kind of loosely grouped together, right? So there's kind of education, and then kind of resources, and then how to talk about certain things. So that makes it a little bit more digestible for people. And then if there's transparency, we added some context and instructions, right? Choose as many options as you need, and we will do our best to connect you with resources. So we're explaining why we're collecting this information. Another idea that we're going to talk about, that we're talking about with being trauma informed, is thinking about referrals. How do we help people feel supported and safe when we're connecting them with other resources? So here's an example. She's saying, I think you're a good fit for the training program at Pleasantville Community College. Registration is April 7th through 18th. The address is 1212 North Oak Street, room 22A. You can call 8675309 if you have any questions. What might make this process difficult for someone, and how could we make it feel easier? What could we do a little bit differently, thinking about our referral processes?
Well, what kind of training program is this? I think that should be clear.
Yeah, yeah. And some of this is for space, but yes, I agree, right? Being clear about why I think this is a good fit for you. I see in the chat, like kind of this reframing it of that this is a good fit for you, right? That this is tailoring it to you. Or I'm like tailoring the information I'm giving you to your needs specifically. I may not refer this to everyone, right? Kind of making that clear. Sometimes we take for granted that people understand that, but they don't. They may not know that. They may not be aware that when we are tailoring things to people's specific needs. So sometimes, there's language things we can do to make that clearer. Right, there's no information about how to register. It would be great to have an online registration option. Yeah. Uh, for people with anxiety, giving more information about who they are calling, right? So giving people a little bit more, there's a lot of uncertainty. There's a lot of questions. What do I do? Who do I talk to? What am I going to have to do to register? What's this program about? Tell me a little bit more about like, how do I get more information about the program? I don't even know if I want to do the program. You're assuming that I'm going to want to do it, but you haven't really given me any information. Right? So thinking about these things. So again, we have limited space, so we don't address all the questions, but here's an alternative, right? And she says, I think you're a good fit for the training program at Pleasantville Community College. They have daytime and evening classes. Here's a brochure with more information. Have you been there before? I think once. I'm not sure how to get there with the bus. Let's look up the route together. And then we can go clickety clack on our computers and look up the route, maybe look at a picture of the street view of the building, kind of help someone navigate that. Registration is April 7th through 18th from 10 a.m. to 7 p.m. When do you think you can go? Probably Thursday morning after I drop my kids off at school. Great. I'll tell my colleague, Kathleen, that you're coming. What questions do you have about the program or registration? We can email her together. So how does this version feel a little bit different? What's different about this example? Thinking about those ideas of being trauma informed.
I mean, it's more helpful, right? And sometimes people do not like asking questions, so sometimes it's best to give them that opportunity to let them know it's okay to ask more questions so they can be clearer.
Yeah. Yeah, so I think a couple of things. One is asking open-ended questions, right? What questions do you have? Not do you have questions, but hey, what's coming up for you? What questions do you have? But also asking questions that engage people in that might bring up questions that they have, right? She doesn't say, do you have questions how to get there, right? Have you been there before? And that naturally leads to a conversation about, actually, I'm not sure how to get there. Oh, well, I can help you. Like that's something we can do together. We can figure out how you can get there. Um, and asking people, right, things like, when do you think you can go, right? Helping someone, uh, there's a lot of research, especially with voting, that when we help people kind of like plan out how they're going to do something, they're more likely to do it. So, the research on voting is like, instead of saying go vote, it's saying, hey, when are you going to go vote? You're going to go Thursday at 10 a.m. Great. And then people are like, okay, I'm going to go Thursday at 10 a.m. I'm going to take this bus to get there. And if you help them with that process, they're way more likely to do it. And that we can extend that to other aspects, right? When we help people kind of make that plan, they're more likely to follow through with it. We're removing those barriers. It's less that they have to figure out on their own. Um, it engages the individual with questions. The tone is welcoming. It's offering assistance, right? We can do this together, right? This collaboration. We're in this together. You don't have to figure it all out on your own. Um, it helps them walk through the process. Yeah. So, and I know some people might be looking at this and being like, this takes more time, right? Like, I might not have time to do this with everyone. So maybe every conversation doesn't look exactly like this. Maybe you have a handout that includes, if this is a common program you refer people to, maybe you have a handout that has a picture of the building and the bus routes that take people that go nearby, right? So that people can kind of figure that out. Or um, a handout that something, a resource that talks about like what the parking situation is. People often have a lot, especially in the city, people are like, I don't know if I can go. Is there parking? How does that work? I don't have extra money to pay for street parking. What am I supposed to do? Um, so it's really thinking about that, kind of anticipating how the needs that might come up and thinking about how we can support people, and also just recognizing that while this might take more time, this person is probably more likely to follow through with the process. And if our goal is to connect people with those resources, especially if that's something we're accountable for, right? A lot of us have to track those referrals or enrollments and kind of if people are following through with that, taking a few extra minutes to support people along the way will lead to better outcomes. And we may end up having to do less follow-up, fewer follow-up phone calls and emails or hunting people down afterwards to figure out if they did what we needed them to do. So how can we be upfront with supporting people? And so some things to think about with the idea of warm referrals, right? Which is really thinking about how do we connect people with resources in a way that feels welcoming, safe, and secure. We can think about things like safety. Can we look up the route? Can we schedule it together instead of having them go home and register? Maybe that's something we do together if it's online, so they can just get it done right now. Thinking about peer support. If there's a way, if this is a program you commonly refer people to, is there another, like I said, a student or an alumni who can help walk them through that process? We also can use people's stories to illustrate, right? Taking on those narratives of people's experiences. Collaboration is thinking about at this referral organization, is there a specific person I can direct people to? Can I have a relationship with that person? Can I say, I know Kathleen, you can call her, she's really great. You can ask her your questions. And tell Kathleen that Sarah sent you. She knows me, right? That can feel really help boost people's confidence. It also helps to make sure that we know we're up to date. I think a lot of times we refer people to programs. This is something I experienced a lot when I was a teacher, is I would say, hey, people would ask about resources and I'd say, oh, you live in this neighborhood, check out this resource. But then the information I had was no longer up to date. And so then that creates some frustration for folks, right? So making sure we're keeping up, using those relationships to know what's happening with our partner organizations. And again, thinking about how are we giving people choices? Are we just assuming they're going to want to do this program? Are we asking, what do you think about this? Do you think it's a good fit for you? Things like that. And this is the last text example we're gonna be looking at. Take a second to read it. It's a little bit long, a little bit denser. It's describing an intake process. So unmute or share in the chat. What could be challenging for someone who's trying to read this, or what opportunities do you see to make it clearer?
This is actually the client is reading this.
Yes.
So I don't think it should say the client. I don't think it should read like that. It should read like this is specifically for me. So information will be gathered on your work experience, education, and so
Yeah.
on.
Yeah, there's a clear opportunity to talk directly to our audience, right? It's kind of this feels like it was written feels very like almost clinical. It doesn't feel like it's for me. It's maybe feels like it's for someone else who works in this field or colleagues. I see why so much passive voice. Yeah, there's a ton of passive language. So things like information will be gathered on the client's work experience. Who's gathering that information? It's passive. It's not clear who's doing that action. And passive voice is both more difficult for most people to read in English. It's a little bit more challenging and also can feel really vague and unclear sometimes. So it's something to pay attention to. And the format, right? It's just a big chunk of text. There's no like variation. It's just like a lot of words. Just feels like I'm throwing a lot of words at you. Awesome. So let's look at an alternative. How does this version serve the audience better? Specifically thinking about these ideas of being trauma-informed in communication. What do you notice? And a lot of the feedback you all already have comes out in this example.
Definitely more personal.
Yeah. Uses that we and you, right? We're going to do this. You're going to do this.
I always like bullet points. I like it to be broken down easily.
Yeah.
Gives clear information on how long you can expect for the meeting to occur and an opportunity to ask questions.
Yeah. So it's providing that this meeting takes this long so you can be prepared. I think again, that's one of those things, the curse of knowledge. We kind of often we know that, but we forget to tell other people. And then it's giving that kind of those instructions on how to get support if you have questions or need something. This will stay up. I'm just gonna pull up so thinking about the ideas of being trauma informed, the idea of collaboration, using we and you, it feels more casual and it feels like we're in this together. I am talking to you and we are a team. We're gonna make this thing happen. It doesn't feel like I'm talking down to you. It feels like I'm connecting with you in a respectful and like we are equals kind of way. It is talking about trust and transparency. So using that everyday language to explain the process. What are we going to talk about and why are we going to talk about it, right? So we're going to talk about why you're unemployed so we can help you explain this, right? We're not asking to make you feel bad. We're asking so we can help you articulate it to others. And then when we think about the empowerment and voice, it's including that space for questions and concerns, how to respond. Any other comments, questions, or observations about this example? Okay. Some additional things to consider when we're thinking about this idea of trauma-informed communication is offering meaningful choices. So when we think about how to give people choices, we don't want to overwhelm people, right? I think a lot of folks have heard this example of like when we talk about decision fatigue, when we have too many choices, it becomes really hard to make a decision. So we want to limit to like two to four options is probably better than, but like 3 to 5, no more than 5, then it starts getting people are like, I don't know what to do. And they should be meaningfully different, right? We're thinking about how do we make choices that impact how someone's engaging with our information or our programs, but they're not having a different quality of experience. And that's part of where thinking about our capacity comes in, which we want to offer if we have contact information and we have call us or email us, but then no one is monitoring that email address, that's not a meaningfully choice. People who are choosing to email are going to have a worse experience, and that's not good. We don't want to do that, right? So really being thoughtful about our capacity, and thinking about how we can honor the ways people experience the world and their preferences for how they engage. So this is an example. From a VA website. And it's like, right, it has these different options for how to get assistance. And it explains, so it has option 1, you can apply online and gives a little bit of context for that decision. You can apply by mail, you can do it in person, or you can get the help of a trained professional, and links to resources to get help so people can, if they choose that. So it's giving people some information about like helping people understand why they might choose the different one, right? If they prefer to do things on paper, maybe they don't have a printer, so they can't mail it, so they can come in person and do it. So this is an example of it's a meaningful choice because it's helping me choose what makes the most sense for my experience and my life. But hopefully it's not whether I choose to apply online or in person, the quality of my experience isn't going to be different. Things like that. Another piece we want to think about is how we are breaking up processes and steps, and especially in if we're doing like presentations, but also just like across content or within our content, making sure that when we have different processes that people can kind of digest one step at a time. So if you do presentations, some tips, there's kind of 2 ways to break up processes in a way that feels digestible. One is to do it across multiple slides. So you might have something like, let's talk about what happens next. And you might have step 1, step 2, step 3. Right? So breaking out those different steps, each one is on a different slide. You also might be like, no, people need to see the whole picture, right? Sometimes we don't want to break up information because we want people to have the whole picture in one place. And that's where doing things like using animations can be really helpful. So you might have like, what happens next? Let's talk about what happens next. And then use the slide animations to be like, let's talk about step 1. So people are only focusing on the information that you're sharing. And then step 2, again, people can focus on that. There's not too much going on. There's new information and they can focus on the new information. And then you could do the same for step 3. And so this way, in the final version, people have the whole picture. They can see the whole process in one place, but we're not throwing them everything at once. And so those are just 2 approaches you can think about. What you choose is going to depend on your context and your audience. But if it feels difficult to explain processes clearly, I encourage you to maybe change the process. And this is something that this is a common thing. We've even at Literacy Works, we'll be like, oh, we have this process, and we're like, actually, it's really unclear, and we could just do it differently instead of trying to go through all these different steps to explain it clearly. Another piece to think about when we're kind of breaking up information, and we talked about this a little bit last week, is how do we spread content across our different touch points with people, across the different interactions we have with people. So there's this idea of bite snacks and meals, and that's really thinking about the amount of content we're sharing and how deep that content goes, right? How much detail it has, how much nuance it has. And so a bite might be something like a brochure, a handout, a flyer, and these are things that are meant to introduce people to information. A handout or a flyer about our program is not meant to cover every single detail about it. It's really meant to grab people's attention, get them curious, maybe say, I might be interested in that. And then we have our snack, which is maybe our community presentation, where we meet with people in the community and we say, okay, let's get into more detail. Um, maybe our flyer says that there's income restrictions to this program, and then when we get into the community presentation, we can break down what those restrictions are, talk about maybe why they are the way that they are, but getting into more detail when we're in a space where people can ask questions in real time. That's really the benefit of being live with people is we can get into more of some of that nuance and create space for questions that people might have. And then maybe our website really gets into the full details. Well, that's where we have our application. That's where people can find kind of the full agenda of the program or something like that, right? So it might look different, but really depending on the interactions you have with people, maybe you have two phone calls with someone, maybe you have a phone call and a meeting. But thinking strategically about how do we introduce people to content, and then once they've had a time to kind of like nibble on that, think about it, process it, okay, now we can give them a little bit more. And being strategic about that, or maybe we have one touch point with people and it's like, what do I tell you during this initial interaction? And then what resources can I give you so that when you go home and you're thinking about this, you have questions, you want to know more about it when I'm not there, is there a web page? Is there a handout? Is there a video that I can share with you so you can dig into this more later? And the last tip I want to share is just using stories to make content relatable. So this is part of that idea of peer support. If we can, maybe we don't have a real human we can connect someone with, but how can we use stories to help people see what experiences are like, what processes are like, and things like that. The last piece we're going to talk about today is reflecting on our work. That was a big part of that value of humility and responsiveness. We can't be responsive if we're not thinking about what we're doing. At Literacy Works, we love the quote, we do not learn from experience, we learn from reflecting on our experience. That's how we grow. That's how we get better at what we're doing. So common, there's different ways that we can do reflection, but one is this cycle of reflection. So we can think about how do we remember what we did, right? So thinking about if you do like intake phone calls, right? Kind of jotting down, okay, this is how I explained this idea. These are the resources that I shared, things like that. Kind of making notes to remember what we did and then to reflect on what went well, what didn't go well, what maybe we could do differently. And then change what we're doing, right? Try something new, and then the cycle continues. We kind of document what we did, so we can reflect on it and move forward. So some ways I think that a lot of times people struggle with this idea of documenting what we did, what we're doing, so that we can reflect on it. So this doesn't have to be a big thing, right? We don't need getting data doesn't always have to be a focus group or a survey. There are some pretty low effort ways we can do this. So it could be things like having a shared doc that all staff can add to when they get questions, challenges, when they notice people making mistakes. Maybe there's a question on your intake form that people always kind of respond to in a way that you're not expecting. So we can add that to the shared doc, and then at a future staff meeting, go through it and be like, oh, wow, we get this question a lot, or this part of the process seems to be challenging for people. Um, uh, the other idea is kind of using checklists, right? Having some simple checklists that people use and follow, that they're expected to consistently follow those steps. You could also have reoccurring moments on your agenda, just like setting aside consistent time to talk about what you did and how it went. And then something like if you are trying something new, just having a sticky note on your desk and having a good call, bad call, right? Or that went well, that didn't go well, and just kind of keeping track of the tallies. If you so that you can reflect on kind of noticing what's happening. So I'm curious from folks, uh, what does reflection look like in your work right now? Or are there areas where you're thinking about maybe that you could have more reflection? There's some opportunities to reflect a little bit more on what you're doing. And I think part of the idea here is that we're we're always going to be, right? Things are always going to be changing about our work. We want to be responsive to the needs of the folks that we're working with. So the point of this isn't to create just another thing that we have to do. The point of it is thinking about if we're gonna have to change things, right? Things aren't always gonna be go well the first time, making sure that we're doing that in a thoughtful way, that we're not just kind of grabbing at straws, but that we have a plan for what we're doing. And in order to have that plan, um we have to have like a thoughtful approach. So I feel like I'm always in survival mode, right? That's what we're right. That's real. That's like a lot of people experience that. So thinking about how can we create moments to have that reflection to so that we're not, it doesn't feel like we're always in survival mode, that we can be intentional and thoughtful about what we're doing. I encourage if there's any folks here who are in kind of supervisory positions, really thinking about how you're making time for this with the staff that you're supervising. Maybe that means shifting some of the work expectations. I also, we've seen that some of these practices can feel like a lot to get started, but once they're part of how kind of your regular workflow, um, other stuff becomes easier, right? When we can kind of do things intentionally and thoughtfully up front, really take time to be thoughtful about how we're communicating about our work, then we spend less time answering questions on the back end, right? So, thinking about how we're making that time. And if you're not in a supervisory role, doing what you can to advocate for these spaces or creating that space, that peer support space with your colleagues and kind of creating that reflection space where you can. So we're going to get into some wrapping up. Just some reminders that trauma-informed communication is about creating welcoming content and processes. So it's things like having clear instructions and signage, and explaining all the steps, having really clear timelines, making sure that we're closing the loop with people. We're not leaving them hanging, but we're following up on, if we ask someone to email us, we respond to those emails, or if someone emails us a question, that we respond to it. That we're offering choices, different ways for folks to engage, being explicit about what people need to do, prepare, or bring to things, making sure our information is accurate, and always creating that space for questions and support. So in our last couple of minutes, I'd love to hear kind of what's coming up for folks, if you still have questions, if there's something you're curious to learn more about, or if there's a strategy that you're excited to try from what we shared today. You can unmute it or share in the chat.
Okay, I guess I'll share.
Yeah, go ahead.
So in Illinois, we've really been focusing on clear language, um, providing all the necessary communication for claimants for them to do what they need to do, so they can receive benefits and whatever other services that we have to provide. So this helps us to see that we are going in the right direction, and it gives us ideas on different ways to go about communicating. So yeah,
Awesome.
that's it.
I'm glad to hear it feels kind of useful and relevant to things that are already happening in your work.
Definitely.
Yeah. And feel free if folks think of other stuff to drop it in the chat. I'm gonna share the resources link one more time. Again, you can save this. It's a living document, so if someone has specific resources that you're looking for and you email me, I'll add it to that document. So save it somewhere useful. And the slides are linked in there. We also, as part of this training, have a limited 3 1-hour consulting sessions. So if you're like, I have something for my work that I want support with, I'd really like some help with, you can sign up for those one of those sessions. They are first come, first serve. So when they're gone, they're gone. But it's an opportunity to get some individualized support with your work, and that is there's more information in that training resources doc that I shared in the chat about what those conversations look like. Another opportunity for additional support is we have monthly office hours. Our next one is on June 10th. And so this is a great space if you have a quick question or you're like thinking about your documents and you're like, oh, I don't know, I'm not sure how to format this, or I know this isn't like I know this could be better, but I'm not sure where to start. Our office hours are a great place for questions like that. And then we have a skill builder workshop coming up where we're going to be talking about using lists. So if you're like, I know I want to use more bullet points, but I'm not sure how to do it well, that's a great opportunity to learn about that. Yeah, so feel free to check out it's uh, PDF. Oh, oh, thank you for calling that out. I didn't realize that. If you put the bit.ly in directly, that should definitely work. But let me re-enter it. I think I had tried to make it a shortened link and I still had the I will do that in a second. It should, let's do this. Okay, the link I am sending now should work. If it doesn't, let me know. Cool, awesome. Yeah, I think that was the hyperlink. I pasted the wrong link before. Sorry about that. But if anyone needs help getting to the right place, let me know. And then I know Kirsten's gonna send out an evaluation. We also have our own training survey if you would like to fill that out. If you only do one, do hers. It's more important. But if you would like to give me some feedback, I always love to hear it. So I'm gonna put that in the chat and you can do that. And then that's kind of all for our content today. If there are no other questions that folks have, thank you so much for being here, for being engaged and asking questions. And I hope to see you all around at other stuff.
Yes, thank you so much, Sarah. We appreciate your time. Any other questions before we close out today? All right. Thank you so much, Sarah. Everyone have a great rest of your Wednesday.
Take care, everyone.